Welcome to Adapting Class. If you take your NCLEX, you may see these drugs called sulfonamide. Don't panic. You know the answer. It may look foreign to you, but I'm here to show you that you already know. I'm going to give you a very quick, easy way to remember them. Then we practice some question. One of your friends had a question like that. Don't panic. It's easy. They can ask you. And so let's get to it in a very straightforward way. Sulfonamide. What are those medications? These are antibiotics. It's different antibiotic. I did a video on antibiotics. You should look at it. I talk about them. I'm taking specifically this specific class of antibiotic, sulfonamide, right? It's an antibiotic class. What do? They are used for UTI. They are also used for otitis media. That means ear infection. Then you can use it for bronchitis. They have a very wide range of treatments. You don't need to know the details about which specific organism they're going to ask you. NCLEX is not going to ask you that. It can also be used for traveling diarrhea. But what are the most important things you're supposed to know is examples of that. One of the examples is Bactrim and Septra. They're not going to use that word, Bactrim or Septra. They're going to use sulfamethoxazole trimethoprim, right? Sulfamethoxazole trimethoprim. It's a long one. Everybody call it Bactrim. But as soon as you see the S, you know it's a sulfur drug. This is the most common one. Everybody know. But there's a bunch of medications that are also sulfur drugs, but they are not sulfonamides, right? Sulfonamides usually used specifically for antibiotic, but they are sulfur drug. Amiodarone is a sulfur drug, but it's not a sulfonamide. Sulfonamide are a class of antibiotic that contains sulfur drugs. So one of those examples is sulfamethoxazole trimethoprim. The other one is sulfamethoxazole. It's not important. The first one is the most important. If the NCLEX is going to ask you, is the sulfamethoxazole trimethoprim. That's the one they're going to ask you. Now, what do you need to know? How do they work? If you know how they work, you'll be able to figure out the side effect associated with it. One of the common thing they do is they inhibit folic acid synthesis. Think about it. When a pregnant lady, during preconception, we want you to have increased amount of folate in order to prevent neurotube defects. Well, sulfonamide block folic acid synthesis. Therefore, you think a pregnant lady should take it? No, it's not good. It can affect bacterial growth, and this can lead to anemia. So that's one of the biggest side effects associated with that. But what is the NCLEX is going to ask you is this side effect. Please take a picture of it, remember them, but it's easy. Like I told you, you already know it. If you know sulfur drug, you know the side effect of sulfonamide. What is the first one? The name is where you can get the major side effect. It's a sulfur, so that's where most of the major side effects, you can use this trick acronym to figure it out. One of the first one is the S, sunlight. You should stay away from sun. It doesn't mean you can't go out of the sun. Well, you got to wear sunscreen. You got to wear a hat, long sleeves, protect your skin because of photosensitivity associated with it. This is not that big as a deal. You can teach the patient. So the risk reduction, you teach them to have a sunscreen on, avoid sunlight. If you're going out, wear a cap or long sleeve. Then the U, you can form kidney stone. These are crystallized stone. Because of that, what do you tell the patient? 2 to 3 liters of water a day. Hydrate yourself to prevent stone formation. The third one is L. It leads to low folic acid, right? That can lead to anemia. And then the F is the biggest of all. The F, they can have fever associated with the rash. When you see that, this is not allergic reaction. This is Stevens-Johnson syndrome. You can start with the what? Small purple rash on the chest or the torso. Anybody taking sulfur drug and you see that, you got to intervene. Prioritization 101. You have to be sharp. This patient is going to die, severe sepsis. And so that's the F. And then the A is anorexia. You have some GI side effects. So you don't want to take anything that will worsen the GI side effect. These are the 5 major side effects of our sulfur drug. Most sulfur drug have the same thing. So if they give you a question, they say this drug is a sulfur drug, you can use sulfur as the major side effect. Like I told you, you already know it, you see, because you watch adapting class, right? Now, there are other NCLEX alert information you're supposed to know, because if they don't give you the sulfur, these ones are outlier because they don't follow the sulfur group. And that is bone marrow suppression. So you can lead to pancytopenia, like low white count, low platelet, and low anemia. So watch for that bone marrow suppression because of the folic acid synthesis, which are used by the DNA cells. It causes hyperkalemia, right? The trimethoprim portion of it. So you have to be careful. You can't combine it with any medication that causes hyperkalemia. You see, this is what the NCLEX is going to ask you. Now, few things. We already know what it does, the side effect. Therefore, don't make sure NCLEX is going to ask you this, because they want you to protect the patient, prevent the patient from getting into trouble. So I got to know what I need to do with this medication, so that if I see the patient taking another medication or have a certain condition, they cannot take it. Contraindication. If you're pregnant, you know that, right? It can cause a baby problem, or infant that is less than 2 months. It can lead to bilirubin formation that will increase, that cause brain damage. And what do we call it? Connectorates. This is brain damage due to bilirubin. They look yellow, they are all body yellow, and there is a damage to the liver, and then damage to the brain. The next one is you should avoid sulfur allergy. If you take anything, right, and you are allergic to sulfur, you should never take sulfonamide. Even a tiny allergy associated with it, you're going to have a reaction. So that's the thing. And then it's cleared by the liver and the kidney. The major portion of it is by the kidney. So if you have kidney function problem, it's also a problem. So know the contraindication. This is the teaching portion of it, and the prioritization portion where you get to intervene, question the doctor based on the patient condition. We practice a question and you see what I mean by that. There is interaction with other drugs based on the side effect I told you. You remember potassium? Yeah, it can increase risks of bleeding in warfarin. It doesn't mean you can't take warfarin. I'm going to monitor you, right? It can potentiate the effect of warfarin, but you can still take sulfur drug. I need to make sure I check your INR. It doesn't mean you shouldn't take it, right? It can also increases hypoglycemia, right? In patients who take sulfonylurea, right? It potentiates the effect. There's some sugar medication, diabetic medication that has a classification of sulfonylurea, which are also sulfur drug. So when you take it together, it potentiates the effect because it's hypoglycemia. And it causes hyperkalemia. Therefore, you should avoid ACE inhibitor, ARB, and all those things, spironolactone, any potassium-sparing agent. And finally, phenotime is also a sulfur drug, so you should avoid it. Also for drug. It can also interact with it. It causes increase the effect of phenotime. So now, questions, straightforward. We're going to apply it. You know I have to answer question. Start from the back, figure out the buzzword, and then answer the question. Which instruction should the nurse include? Based on what? A client is prescribed was sulfa, metronidazole, trimethoprim. It's a sulfur drug. S give it that way. If you look at the first 5 letters, SULFA is a sulfur drug. And so what is the instruction the nurse should provide? Based on the definition of sulfur? Any contraindication? You want to prevent things associated with the sulfur. Take with food daily, right? Well, even though it causes nausea, there's no need to do, you have to take it with food, right? There's no hard fat rule that you have to. You can take it without food or not. This is a trap. Increase fluid intake 2 to 3 liters of water so that you don't form kidney stone. Increase potassium-rich food. It causes hyperkalemia. You should not do that. Use aspirin for fever management. This is a trap. Think about it. It's a trap. Use aspirin for fever management. If I have a fever, well, I don't know if it's a Stevie Johnson. Remember Sulfa, the F is what? Fever. Fever associated with the rash and Stevens-Johnson. So you got to figure out that patient is not having reaction due to what? Stevens-Johnson syndrome. Or even if you take the aspirin, it can affect your other symptoms that can worsen their GI symptoms. So you don't want to take it with the aspirin, can worsen your GI symptoms. So the right answer is number 2, increase fluid intake. What is the next priority action? A client taking sulfonamides, right? Develop a widespread rash and then reporting peeling skin. You see, they don't give you the medication, they give you a group, sulfonamides. That means the whole group, right? Now they have rash and peeling skin. The rash, peeling skin is associated with what? The fever and rash. That means Stevens-Johnson syndrome. We have a problem. Hydrating the patient is not going to fix it. There's more priority information. It's not going to fix the fever and the rash. You cannot document and reassure the client. He has widespread rash and peeling skin. That's Stevens-Johnson syndrome. Discontinues the medication and notify the healthcare provider. That sounds right. If you give them diphenhydramine, you're thinking this is allergy. Rash and peeling skin is not allergy. It's a Stevens-Johnson syndrome. That's sepsis. So 3 is the right answer. And the last one, a nurse is reviewing new prescription orders for several clients. Which client is not a candidate for sulfonamide therapy? That means which one is contraindicated. And I said there's certain things you should look for. Write down the sulfa down, right? So drug, right? And it said S, okay? You know what S is, right? Sunlight, photosensitivity, uric acid, right? And forming uric stone, forming stone. Then you have folic acid decreasing. Then you have Stevens-Johnson. Then you have GI symptoms. There's certain people that cannot take it, right? A young kid, 3-week-old infant, they're going to have connectorates, brain injury due to bilirubin increase. And so that one is contraindicated, number 1. Pregnant lady cannot get it because then it can give it to the baby. It can pass the placenta barrier and it get to the baby, and the baby will develop connectorates. So 1 and 2 is out. You can take it if you take warfarin. We just have to monitor your INR so that you don't bleed. It doesn't mean it's a contraindication, right? The client with the kidney disease is cleared by the liver and the kidney. Therefore, this is not good. And the client who has sulfur allergy cannot take the thing. So 1, 2, 4, and 5 cannot take this medication. This is a straightforward video just to help you understand what are sulfonamide. Use 3 questions to analyze it. Take care of yourself, and thank you for watching. Good luck.